Sorry, part two. So for our interventions, priorities, and whatnot, as a nurse, we see that an asthma attack is it's a serious thing. It impairs the airway and reduces the patient's ability to get oxygen. So the very first intervention that we should be looking at is to get to assess the patient's pulse ox level, and also take the lungs, looking for wheezing, crackling, stuff like that. Then we should institute therapies right away. First thing would be get them on supplemental O2. And I say that's first just because, okay, if we are in an ED and we don't have actual drugs on hand, the first thing that we should be able to grab is oxygen off the wall, stick it in their nose. Then priorities include medications. So we have, for our medications, we have multiple types. So the first ones we're going to be looking at is the short acting beta 2 or agonists, which they mediate the swelling response and dilates the bronchioles, so it opens it up, allowing more air in. So like our rescue inhalers, and then ones that are anti-cholinergic, cholinergics. Basically, they inhibit the muscarinic cholinergic receptors and reduce intrinsic vagal tone. Then we have corticosteroids, which it mediates the inflammatory response. And then those are going to be our priority drugs, the ones that are going to rapidly take effect. The other drugs that are included in treatments for asthma are going to be more of the long-term chronic management of symptoms rather than the acute respiratory I'm in distress kind of thing. Let's see, the next one is what would our priority teachings be? Or three important things to teach, rather, I should say. Number one, a lot of times these diagnoses come early, and kids aren't 100% aware exactly how to use these things. Inhalers, it is. So that should be our very first instruction. You never assume the patient understands what they're doing, especially as a child. So we need to teach them exactly how to inhale, hold, exhale, and for 2 iterations. I've heard stories of people coming a couple inches to, away from their face and spraying it, kind of like the old school Banaka. And obviously that is wildly ineffective. Other people I've heard put it in their mouth, squeeze, but they breathe in their nose, which doesn't exactly get the drug into their lungs. The next one's going to be a behavior modification techniques. Being able to, because like I said, everybody's different. They react to different allergies or triggers differently than others do. So it's going to be a exercise for the patient to learn how to identify their individual triggers and how to modify their behavior to avoid causing those triggers if possible. And then number 3 is they need to understand what they're taking, the medications they're taking. They need to know the difference between a rescue inhaler. They need to know a controller medication inhaler, sort of like an Advair, a long term, like an NSAID, and then and a nebulizer, which vaporizes and humidifies just air, and you can use a face mask, which are pretty good for kids under 5. Those are one of the better ones, just because the conscious thought of breathing in and inhaling an inhaler device might be a little difficult for 3 to 5 year old to be able to grasp. And so, but yes, like I said, what the machines are and how they're delivered and why they're delivered is going to be one of the biggest ones that you can actually put out there. And then for the community resources available to clients, like I said, it's like Bond Police for Children. So that's what I focused on, especially because, like I said, asthma tends to affect. I guess it would have the most pronounced effect on children, just because it's so new to them, so foreign. So two of the things that I saw was one is this one called Camp Soaring Eagle. I'm focusing on Phoenix, Greater Phoenix area. One's called Camp Soaring Eagle. It's free asthma respiratory camp for kids, and they can do all these activities like horseback riding, fishing, arts and crafts, and then the other one is gosh, where did it go? Asthma Athletics. It's a athletic organization, nonprofit for low income families, uh, you know, specifically for people with asthma, and with not just asthma but all long term diagnoses. One of the biggest things that we can do is prepare their psyche, their mental, to understand that life with this disease is not debilitating, and teach them how to have the most of their to make the most of their life, even though they have an issue. So, especially something like asthma, like that can be well controlled in most instances. We need to teach them how to be able to live life to the fullest while avoiding their triggers and maintaining their medications, and show them that this diagnosis is not a death sentence. It's more just a mere inconvenience than anything. So that's why I chose those, is because starting the mental transition to, hey, this doesn't define me as a kid. I think that's one of the most important things we can do. Thank you very much. Sorry to talk so long.